Good evening, and welcome to the Social Distancing Lecture Series, Historical Perspectives on Sickness, Health, sponsored by the Department of History at Davidson College. My name is Devin Spence Benson. I'm an Associate Professor of Africana and Latin American Studies here at Davidson College. Thank you so much for tuning in this evening, and I hope that each one of you and your families are staying safe and healthy and coping as best as you can with the current global pandemic. While it saddens me that I cannot interact with each of you face to face at this time, I'm so honored and blessed that technology allows us to come together in this moment to create a virtual learning community, to share ideas, and to debate the most pressing concerns of our times, just like we would normally do on campus at Davidson College. This is the fifth of 6 lectures in the Social Distancing Lecture Series. Each Wednesday from now until May 6th, so you've got one more to go, a member of Davidson College's faculty will moderate a conversation with a scholar who will share their research about the human experiences of disease and recovery in the past in order to help us to understand the experiences of the current pandemic. You can see the recordings of our previous talks and learn more about our 6th and final lecture on the same webpage where you found this link. Tonight, our speaker will talk for about 30 minutes, and then we'll have time for questions. At any point during the event, you can send your questions to us using the YouTube live chat. You will need to log in using your Davidson ID or the Google ID to participate in the live chat. If you feel comfortable doing so, please let us know your name, where you are now, and if you're a student, faculty member, staff member, alum, community member, or if you're joining us from another community altogether. We would really love to know who's out there and who's participating. Before we would begin, I would also like to thank the staff members who've made this incredible series possible. Ebony Stubbs, Amy Elkins, Daniel Lines, Adele Patton, Winnie Newton, and everyone at College Communications. I also want to thank my colleague in the History Department, Rose Strumlau, for dreaming up and organizing this series. It has been a huge success. Thank you to everyone. Tonight, it's my pleasure to introduce my close friend, colleague, and fellow Cubanist, Dr. Jennifer Lambe. Dr. Lambe is an associate professor of Latin American and Caribbean history at Brown University. Her book, Madhouse: Psychiatry and the Politics in Cuban History, was published by the University of North Carolina Press in 2017. Madhouse traces the history of mental illness and mental healing in Cuba through the Mazorra Mental Asylum, the only public psychiatric hospital in Cuba until the 1959 revolution, and a key site of political intervention and social reform. Lambe's work, which has received support from the American Council of Learned Societies, the Andrew W. Mellon Foundation, the Coordinating Council for Women in History, and the Cuban Heritage Collection, explores the intersection between political history, intellectual history, and popular culture. She is currently working on 2 new projects. 1, Leisure in the Cuban Revolution, and 2, The Transnational History of Psychiatric Dehospitalization. She's also co-editor with Michael Bustamante of The Revolution from Within, 1959 to 1980, which just came out with Duke University Press last year and explores the newest and most innovative historical research about Cuba. As you can tell from these many publications and awards, Dr. Jenny Lambe is a prolific scholar of Cuban history, but she's also one of my closest friends and a partner in crime when we're in Cuba. One of my favorite memories of our time together is when we randomly ran into each other at Copelia in Havana, which is the ice cream shop on the corner of 23 and L. So we're both in Havana for different research trips. Neither one of us knew the other person was there. And of course it's hot, so we each are stopping to get ice cream. And I look over and who's sitting at the counter, but of course, Jenny Lambe. That is the beginning of many times that we have sort of hung out both in Havana and in the United States and shared so many great opportunities and conversations and debates. So speaking of ice cream, you're in for a real treat tonight. Tonight, we will have the talk, Disease, Politics and Power from the View from Cuba. And I'm so excited to turn over the cam now to Dr. Jennifer Lambe. Thank you, Jenny, for being with us.
Thank you so much, Devin. And even though it's not the same as hanging out and eating ice cream together in Havana, I'm just excited to see your face. So thanks to you and to Rose for this amazing invitation. I'm also grateful to Ebony and Adele and everyone else who made it possible. I'm really looking forward to spending time with all of you tonight and to hearing your questions and comments at the end. So as Devin mentioned, my research in the past has focused on the history of psychiatry and medicine in Cuba, and especially the relationship between political history and medical history. And so today I'm going to talk about some research that bridges that first and second project, specifically with a focus on the evolution of social relations and popular understandings of state power following the 1959 revolution. But it was actually a project situated squarely within the history of medicine that got me on this track to begin with, specifically the discovery of an archive containing transcripts of a Miami radio show that was broadcast via US government-funded channels into Cuba and Latin America called El Médico y Usted, the doctor and you. And it was designed to provide a forum for listeners to interact with a particularly prominent physician, a man by the name of Dr. Antonio Maceo, who was in fact the grandson, for the Cubans and Cubanists out there, of the celebrated patriot of Cuban independence wars, and one of a few very prominent Afro-Cuban leaders in the exile community. So as this program's existence itself would suggest, medical politics were tightly overwoven with state politics, not only over the long sweep of Cuban history, but particularly in the heightened circumstances of the Cold War and the tensions between the United States and Cuba at this moment. And so in going through the show's transcripts, I became interested in how discussions of medical scarcity on the island, largely stemming from strained economic and political relations between the US and Cuba, were weaponized by political figures on both sides of the Florida Straits. How a particular framing of medical scarcity would be constructed as, on one hand, as a failure of revolutionary governance, or how revolutionary officials in turn use these kinds of allegations of scarcity to decry US economic sanctions as they impacted the island's medical infrastructure. And if you follow Cuban politics at all, you'll know that this is not just a conversation of the past, this is very much the conversation of our present moment as well. But I became increasingly invested in also trying to think through what medical scarcity and scarcity in general looked like and how it was processed on the ground, how ordinary Cubans thought about scarcity, the frameworks they used to assess it, and the strategies they employed to alleviate it. Again, also a conversation of both the past and the present. So as you might imagine, some of what we've witnessed over the last couple months has brought this research back to the front of my mind. In the United States, at the level of consumer anxieties about the absence of toilet paper from shelves, which tells us quite a lot about US consumer perceptions, but also social mores. It's an anxiety that seems completely ludicrous to many people around the world. The idea that in the face of a respiratory illness, the first thing US citizens would do would be to buy up all of the toilet paper. But I think even more seriously, this has led me to think once again about medical scarcity. How it is, for example, in our own context, that the world's wealthiest nation has found itself so ill-equipped to address the most basic and prosaic material demands on its healthcare system in the context of a pandemic, not just an absence of a vaccine or medications, but of the most basic PPE, gloves, masks, ventilators. And also how those medical shortages began to reverberate in popular culture, as enterprising Etsy sellers and ordinary citizens alike have, according to the instructions of the CDC, set out on the task of making their own masks for everyday use. So I want to start by stepping back and giving some context to think through how conditions of medical scarcity came to predominate in a somewhat different time and place, early revolutionary Cuba. And then at the end, shift to thinking through, hopefully with all of you, what implications that might have for contemporary Cuba as it once again becomes a regional leader in battling COVID-19, and also perhaps beyond Cuba. So just to sketch some very basic historical context out here, many of you will know that the Cuban Revolution emerges out of a successful mobilization against a particularly notorious dictator, Fulgencio Batista, a mobilization that comes to be led by a young and enterprising lawyer by the name of Fidel Castro. The movement comes to power with broad middle class and popular support. And though there's some early concern, especially in US political circles, about potential radical or communist influences in the movement, at the beginning, there isn't really that clear ideological framing beyond a kind of nationalist, populist, and we would say social democratic appeal. So once the movement comes to power in January 1959, there's a kind of honeymoon period, a wait and see moment, if you will, among US policymakers that quickly gives way to something quite different, increasingly strained relations with the implementation of relatively moderate agrarian reform in Cuba, expanding commercial and political relations with the Soviet Union, and of course, the beginning of active plotting within the US government against the revolutionary leaders in Cuba. This culminates in the installation of an economic embargo that of course still prevails in 2020, and the rupture of diplomatic relations. And given the proximity between the US and Cuban economies at the time, this has really far-reaching consequences, and is particularly visible in the pharmaceutical and medical landscape of the island due to the prevalence of brand name US medications, especially the appeal that they had among middle class and upper class urban consumers. So what exactly does pharmaceutical shortage mean in early revolutionary Cuba? Why does it become such a prominent feature of political battles on both sides of the Florida Straits? Well, first we would have to turn to the efforts of the revolutionary government to in fact expand healthcare access across the island, especially in rural and remote areas among previously underserved or non-served constituencies. Which unleashes a battle over drug prices, which had been largely set before 1959 by US pharmaceutical interests in Cuba. And by January 1960, this amounts to something like a 50% price cut in medications on the island and the nationalization of drug production. Now, if you've learned anything about the US embargo against Cuba, you might know that in principle, it excludes medications and food and theoretically allows for humanitarian donations. But very early on, in spite of that, we see widespread shortages on the island, particularly again in the area of pharmaceuticals, raising the question from the beginning of why exactly there are shortages. Is it because US pharmaceutical companies are in fact implementing a kind of unofficial boycott against Cuba? Is the revolutionary government itself hoarding medications? And the government implements certain kinds of restrictions on drug circulation to try to address these shortages. And we see some efforts on the US side as well to help deal with drug shortages in Cuba. For example, there's a solidarity organization in New York that organizes to provide medical relief in the form of drug donations and finds itself brought before the Committee on Un-American Activities due to those efforts. But there's some broader political events that quickly come to have an even more direct impact on pharmaceutical conditions. You may know that in April 1961, a force of US trained fighters invade the Bay of Pigs in Cuba, and some of those invaders are captured by the Cuban government and effectively held hostage. And the negotiations over their return come in fact to center on medications. And the person who's in charge of those negotiations, James Donovan, is someone who might be familiar to you. Tom Hanks played him in a movie. And he ends up drawing on his close relationships with the heads of Pfizer and other drug companies to try to bring drugs onto the negotiation table, as it were. Those pharmaceutical companies take advantage of the opportunity to unload outdated drugs on the island in the form of what are called officially donations, but they're actually receiving pretty generous tax breaks for them, totaling something like $1 million worth of drugs. So drugs and some other goods, including, for example, baby products for the hostages who are being held. This too seems to temporarily alleviate drug scarcity in Cuba, but not for long. Very shortly thereafter, the Cuban government is once again plagued by these accusations that they're perhaps hoarding drugs or using them to pay back debts with the Soviet government or to send to allies elsewhere. By 1964, the Cuban government actually is trying to purchase US drugs through a Canadian subsidiary, leading the US Department of Commerce to further rein in sales of food and drugs to Cuba. After that point, you need to have a special license to do so. And Cuba fills the gap, at least in principle, by turning to the Soviet bloc and Canada to some degree to fill those shortages, to make up for what's been lost. So the question, of course, is, as a result, whether scarcity was successfully addressed. And as I quickly learned when I was doing this research, this was actually the hardest question to answer. From the start, the Cuban government is insisting that there is no scarcity, that rather the problem is that ordinary Cubans don't like the generic medications that they're getting from the Soviet Union, say, and what they're missing are those US brand name drugs that they had formed attachments to before 1959. Shortage, of course, and scarcity, these are not absolute measures. On one hand, for many, the revolutionary moment represented a period of expanded pharmaceutical access, especially among disadvantaged and rural communities. But for many middle class and upper class urban dwellers, their touchstone is the pharmaceutical cosmopolitanism that they had enjoyed before 1959. And so this led me to think through the kind of individualized nature of what we could call the material culture of pharmaceuticals, raising questions about the social life of drugs, not just the kind of economic or political life thereof. So how then did this transition from US brand names to Soviet generics, say, impact Cubans of different ages, classes, races, genders, and regions? And how did they experience that shift? I quickly concluded that this language of scarcity was in fact a contingent language, that it was very hard to intervene in these debates about whether there was or wasn't scarcity without taking into account that not everybody is using the same measure to assess that. Interestingly, these battles in Cuba are happening at the exact same moment that the US pharmaceutical industry is under fire at home for high drug prices. This is the moment when generic drugs are also coming to the fore of the US pharmaceutical landscape, resulting in debates over scientific equivalence. In other words, the pharmaceutical companies are basically saying generic drugs aren't as good as a way to discredit them. There's some very prominent Senate hearings over drug fixing by 1962. And so in a way, these two processes are occurring side by side, a shift of sorts to generics and resulting angst at the level of both physicians and consumers about what that shift might mean. In Cuba, not unlike in the United States, many of those who are bemoaning the rise of generics do so because they had experienced this highly embodied relationship to US consumer culture, along with a strong affinity for US material objects. They're the most prone to experience the new medical landscape after 1959 as one of scarcity, but they're not the only ones. And we know this in part because of that archive I alluded to at the beginning. But also, it appears in the very pages of revolutionary newspapers. For example, in Revolución, the most prominent outlet of the revolutionary government, there's a section for a long time where people are writing in requesting certain medications, much to the chagrin of the Minister of Health, who basically ends up shutting down that section of the paper. But the radio show that Dr. Antonio Maceo is running offers another window onto this problematic. It debuts in 1963 as part of CIA-sponsored radio programming designed to arrest the spread of communism in Latin America. And it debuts at actually just the right moment. The Cuban healthcare system is straining at this point, due both to shortages, but also to the exodus of many physicians from the island. And the conflation of high politics and medical politics means that Maceo can use these shortcomings and shortages in the revolutionary public health infrastructure to make a broader point about the failure of revolutionary governance. For example, he devotes frequent attention to outbreaks of gastroenteritis on the island. He talks about the emergence of a class of poorly trained doctors and, of course, shortages of medications. But what I saw in the letters that Cuban listeners were writing back to the show, I was even amazed to see that such letters existed at all, was that they were just as likely to use Maceo not as a source only of information, but actually as a way of accessing medications. One listener wrote to him complaining that she couldn't find cortisone to treat her eczema, another trying to get medication for psoriasis, someone wrote asking for antibiotics to treat their syphilis. And Maceo got so many of these letters that he started labeling them with the very terse shorthand, pide medicina, asking for medicine. So these letters, I think, raise questions about the social effects of shortages. And I was particularly intrigued by this kind of assumed logic of solidarity that governed the letters, that Maceo, as someone in exile, occupied a position of comparative privilege vis-a-vis his Cuban listeners, and thus was presumed to be bound by certain kinds of networks of solidarity and obligation to those listeners. So as I started thinking through the kind of social logic that governed these exchanges over medication, I was thinking about different kinds of notions or new vocabulary that emerges around these social networks. For example, any Cuban or Cubanist will be familiar with the notion of the compromiso, or the obligation, the idea that there are certain kinds of relationships that bind people to one another. And after 1959, there's a particular term that comes to condense these obligations, the term socialismo, which is a play on two words. On one hand, socio, which means friend or buddy, and on the other hand, socialismo, or socialism. That is a kind of economic system in which one is relying on one's friends in order to access material goods that have become increasingly unavailable. So especially in an economy that's governed increasingly by non-monetary exchange, value is actually being attached to social relations as a way to access goods and also get ahead. Scholars of the Soviet Union will very much recognize this idea. In the Soviet Union, there's a different vocabulary attached to it, that of blat. The idea being that, again, when you can't access the things that you're used to accessing, you turn to friends and allies to access them, making those relationships as valuable in many ways as goods or money themselves. These relationships, though, aren't necessarily symmetrical. In fact, in many cases, one party is required to give more than the other because they are able to access more. For example, in the case of Dr. Maceo. And so this archive, for me, helped me to think through the relationship between the material economy and the social economy of revolutionary Cuba, especially in this particularly urgent and embodied terrain of medication. But as I suggested at the start, this is also in some ways subjective terrain, that there are different frames of reference at play when we even assess what scarcity might mean historically. So how should historians think about scarcity? How do we avoid getting pulled into these debates about whether there are or aren't shortages, which, as I said, in Cubanist will recognize as being both the conversation of the past and the conversation of the present in so many ways? I think the answer in some ways is that deciding what does and doesn't count as material pharmaceutical scarcity isn't terribly fruitful unless we also bring those frames of reference into the conversation. So for some Cubans, the revolutionary era amounts to a period in which they see the disappearance of the material medical economy that they knew before. Whereas for others, who are often harder to access in the historical record, given the class or regional bias that is implicit in many of those records, someone else's scarcity might equal a new age of access. But regardless of their relative positioning vis-a-vis these shortages or not shortages as they might have understood them, all Cubans are being pulled into the new social networks and paradigms emerging out of the revolutionary conjuncture. In other words, that social economy is universal, regardless of one's kind of material positioning in relation to its before. That is, new kinds of sociability, collective networks that are emerging as a way to access goods and services. So I think I'll forego any obvious conclusions or extrapolations from that historical context to our own present day moment, though there are some obvious parallels that come to mind. The visibility of our panic over the absence of toilet paper, alongside the invisibility of some very vulnerable populations, such as those staffing the essential and dangerous retail jobs whom we increasingly depend on, or even more so, the many people living in areas where hospital care is remote or completely inaccessible. And we know that these kinds of lines are highly racialized and class-based as well. We're beginning to see more and more attention to this in the mainstream media, but for a long time, of course, this issue was virtually invisible. I also think about the politicization of medical workers in the face of the shortages that they're encountering now, that very much resonates with the context I see in early revolutionary Cuba. But as I suggested, I think in my work, I was equally interested in the kinds of adaptations ordinary Cubans made in their social and material lives to accommodate those new material and political realities. And I think many historians have been pointing out that this may be the most useful contribution we can make to our present day moment, to think through the social life of COVID-19. This is something that we know how to do, especially historians of medicine, who very much considered that relationship between political and medical history in the past. So just to close, I thought I would also open the door in case anyone is interested in exploring it more in questions, to thinking about Cuba's response to COVID-19 in the present vis-a-vis this historical legacy. Um, I think all of you will probably have read about the very visible response that Cuba has mounted in the region, the deployment of international healthcare workers to affected areas. And this has been reported on for good reason. It builds on a long tradition of international health diplomacy by the revolutionary government, and has also become an increasingly important, if not the most important, source of revenue for the Cuban government, which will be facing very difficult circumstances due to the disappearance of the tourist economy as a result of coronavirus. But also on the home front, the comparative ease with which the Cuban government could mount a full-throated, in many cases draconian public health response, given popular expectations about the reach of the government into their embodied lives. So the Cuban government has been able to take stringent measures that would seem almost impossible in the United States. First, fines for violations of stay-at-home orders, quickly barring the entry of international travel, but also placing very strict regulations and restrictions on travel within the island, the close tracking of anyone coming to Cuba from the outside, but even prison sentences in some cases for non-compliance or for leaving hospital against medical advice. And I've also been really intrigued by the popular response to these measures, the authority with which ordinary Cubans transact high-level scientific conversations about COVID-19. Devin and I were talking yesterday about the significant level of awareness and attention that Cubans have been paying to how coronavirus has evolved in the United States. They're concerned about the conditions that people here are facing. The earnestness with which Cubans tend to abide by public health measures, donning masks, gloves, abiding by social distancing. But at the same time, and especially in urban areas, the difficult decisions that they are confronting, because of course they continue to live in a scarcity economy. On the medical front, it can be dizzying almost to think about this high-level international response that the Cuban government is mounting on one hand, alongside the very difficult circumstances that the domestic medical infrastructure is confronting, and the significant challenges that the government faces in accessing the material medical goods that they need, not only because of mismanagement by the government, but also because the US government has decided to continue to enforce, and in some ways enforce more strictly, the embargo at the present day moment. But also because Cubans have to confront conditions of scarcity on other fronts, how to access goods and food without endangering themselves and their families. Of course, there's no Instacart, for example. And the government has, to their credit, been quick to address this by expanding rationings, for example, even mounting some early efforts to provide digital forums for shopping, which seem not to have gone particularly far. But again, coming back to this question of what are the social effects of drug and material scarcity, not just in the past and the present, what kinds of new social networks and even social understandings might emerge out of them? This is a question that I think may be answered quite differently in Cuba than it will be in the United States, and that difference itself may be interesting for those of us who study Cuba to track. So I'll leave it there. I really look forward to your questions and comments, and thanks again for tuning in with us tonight.
Thank you so much, Jenny. That was fantastic. So I guess we can all do a big round of applause at home. Like, thank you for even starting us off with so many thought-provoking things to think about. I mean, just getting us to ask what will be the social effects of scarcity, or scarcity, as I might say as a Southerner. What are the different ways that Cubans are sort of dealing with the crisis, and how have they dealt with those things in the past? There are a couple of questions that are coming in, so I'm going to ask some of those, and then I'm going to insert some of my own. But please feel free to add more questions to the chat about just about anything that you might have touched on. So one of the things that you talked about a little bit was the politicalization of medical workers, and sort of thinking about that as something that both sides and people have used for and against. So one of the questions that we received from the live chat actually came from Cameron Anderson. Thank you, Cameron, for this question, asking when and why did Cuban doctors become considered to be the best, among the best in the world? Sort of how did that process happen?
That's a great question. And how one answers it depends a lot, as usual, on one's frame of reference. So certainly one could look to the post-1959 moment. After this massive exodus of physicians that I alluded to in the early 1960s, we see the emergence of a new class of doctors who, in many cases, have a high degree of allegiance to the political system, or at least in the 60s, feel quite politicized by the context that they're confronting. In Cuba, largely in response to, I think, the politicization of health, both in the Cold War moment, but also in the long sweep of Cuban history, which I'll talk about in a minute, come to really prize public health as one of the shining jewels of the revolutionary government. And as a result, healthcare workers themselves have this really prominent place in the kind of revolutionary imaginary. And that persists well beyond the 1960s into the present day, of course. It means that there are many, many physicians per capita being trained in Cuba. Not irrelevant to this conversation is the fact that medical education is free in Cuba, so there aren't the kinds of impediments to medical training that might exist in other contexts. Although there are questions to being raised from the start as to what kinds of shortcuts are being taken in that training. So something that comes up a lot on Laseo's show is the fact that effectively to deal with the exodus of physicians, Cuba is having to hurry doctors out of their training and effectively into operating as fully trained physicians. There might be some relevant parallels there to all the medical students and nursing students who are being graduated early in our present day moment to confront the kind of circumstances that we're seeing now. So one answer would be that it's the revolution itself that makes medical work so politicized, partially because public health is seen as such an important part of what the revolutionary government is providing to its citizens. But I think those of us who are Cuban historians of Cuba, would be inclined to say that actually this is a centuries old politicization by the time the revolution comes to power, that beginning already in the 19th century with the independence wars, medical work becomes quite politicized for different reasons. Certainly over the course of the period of the Republic, from the beginning of the 20th century to 1959. And partially this is because the Cuban medical system has always been so highly developed compared to fill in the blank. Part of that development, in fact, stems from political circumstances. The island's slave economy, which provided medical professionals with enslaved bodies on whom they began their medical training. So this relationship between Cuba's political history and medical history is really a centuries old one, but of course is endowed with particular importance and vitality by the revolutionary conjuncture itself.
We've got a number of other great questions coming in. So one from Henry Heredia Spratling, who's wondering, would you consider there as a pharmaceutical culture among the Cuban people? And if so, how do you relate it to the vaccination acceptance and the use of homeopathy and other pseudoscientific methods?
This is a really fascinating question. One of the things that became very clear in the course of doing this research, but also working on my first book, is that Cubans have a very intimate relationship with pharmaceuticals. It's a relationship that I think many of us can relate to. So I don't want to make it sound too exceptional or exotic, but there have long been high rates of self-medication on the island, particularly, I would say, in the 20th century. And those high rates of self-medication mean that ordinary Cubans have, there's a kind of obviousness to the way in which they talk about pharmaceuticals, both before and after 1959. And they're perhaps inclined to turn to pharmaceuticals quite quickly. Something that I have to say was rather frustrating to Cuban physicians before and after the revolutionary moment, who are dealing with medically literate patients sitting in front of them, but also sometimes patients who've decided that they know what's best for themselves when it comes to their pharmaceutical lives. And this has some really interesting effects as well. It means that in the face of shortages, that Cubans might have their own remedies that they turn to that may not be strictly pharmaceutical in the sense of brand name drugs. In other words, as the question suggested, there is also a kind of another element of the island's medical landscape, which includes non-prescription drugs, homeopathic treatments, perhaps, botanical treatments, herb treatments, some of those coming out of different religious traditions that exist on the island, but also a very active popular healing tradition. So when I say that there is this kind of highly embodied relationship to drugs that extends well beyond the area of brand name drugs to different kinds of popular remedies. And many Cubans, like many Americans and everybody all around the world, switches back and forth between these different registers with ease. So for one thing, you might want to take aspirin, and for another thing, you decide that you want to take chamomile tea. But I think Cubans are exceptionally literate and have an exceptionally intense relationship to, let's say, pharmaceuticals in an encompassing sense of the term. Even compared to other constituencies. Now, I don't know if in the question, there's also a suggestion of some of the news that's been circulating about a homeopathic remedy for coronavirus that's being promulgated in some contexts by the Cuban government. I guess I can return to that if somebody else is interested in that, but that's certainly out there as well, that in the face of shortages, even the government itself, as in the case of the 1990s following the rupture of the Soviet Union, the close economic relationship the Cuban government had to it, the official medical infrastructure also had to turn to those kind of botanical or homeopathic remedies in the absence of the pharmaceutical remedies they might have otherwise prescribed.
One of the sort of overarching questions that you were having us to think about and that you were encouraging historians to think about was sort of what are the social effects of scarcity and what are the social effects of going to be of what's happening with COVID-19. And so we have a question from Matthew Hill that follows along these lines. He asks, what is happening with the informal economy as a result of the coronavirus crisis?
I think the question is about Cuba, I'm assuming, but
yes.
Okay, because one could ask the same question to our own context here in the United States as well. So there's some really interesting things happening on that front. So the informal economy, we might also just say the non-state economy, because many aspects of the so-called informal economy are not so informal anymore. They're highly organized, in some cases more organized than the official economy. And so I would say there are a couple different ways to think about this. On one hand, it has long been challenging for Cubans who work outside of the state sector, not only to turn a profit, but really to sustain their work in the face of government regulations and restrictions, but also kind of the material realities. So say you want to run a business painting nails. Well, how do you get access to nail polish in Cuba? Usually has to come from outside. How do you get access from goods to outside Cuba? Well, not every Cuban has relatives outside who can send them the goods to, say, start that business. But if you do, that is an entirely different kind of a business organization than what we might think of, right? And so in the face of an island that's under lockdown, when many non-state employees and businesses rely on goods that come from outside of Cuba to function, we can assume that's going to take a really serious toll on the informal economy, but also on the formal economy, on the state economy, which also relies on significant amounts of goods coming in from outside Cuba. But on the other hand, I think there have been some really interesting things happening. There's been some coverage, for example, in Havana of restaurants who have decided to try to continue to provide food services, even in the context of COVID-19, namely food delivery to people who are elderly or vulnerable and can't get out of the house to stand in line to access goods. So there's a sense here that as in the United States, there's some pride being attached to the ability to continue to operate some kind of business that is serving people who are at need, not necessarily for the sake of turning a profit, even in the face of being unable to turn a profit, really. But that the kind of politicization of that work as well, I think, is quite interesting. And I would say would be a social effect that's shared on the US side as well. So some of the debates that are happening, say, in the restaurant scene here, I was listening to a podcast today about the debate in Atlanta, right? So in the face of the decision to reopen the economy, as it were, Atlanta restaurateurs getting together and saying, actually, we should not reopen the economy, or we should not reopen our own businesses for political reasons, right? Because we have an ethical obligation not to do so, especially given the racial disparities that have characterized morbidity and mortality with respect to COVID-19. So there's some room to think, I hear, about the kind of social economy where it meets the actual economy, new kinds of ethics governing economic practice, both in Cuba and in the United States.
Thank you. So we also have a question now from one of the Davidson College Latin American Studies majors. So this is from Marissa Mecki, who she visited Cuba with the Davidson in Cuba program that I led. So she's been to Havana, and she's saying Cuba has sent doctors to other countries to fight against COVID-19. Do any of these countries, like Italy, aid Cuba in accessing medicines, like helping with the scarcity? And does the embargo impact other countries sending medicines to Cuba?
This is a good question. So I would say that the aid comes in the form of payment. So it's not aid, it's payment for services provided. And people who follow Cuba closely had long expected that this kind of arrangement would become an increasingly important part of the Cuban economy. And especially, as I suggested now, when tourism is effectively non-existent, this represents a really important source of revenue. And it's not the first or only instance in which this arrangement has helped the Cuban government stay afloat. You may know that the Cuban government has long sent physicians to other countries who pay the Cuban government in hard currency for the labor that those doctors provide. But of course, they're paying the doctor in Cuban currency. There's still a dual currency system in Cuba. This represents a really important source of revenue for the government. So the question about the US embargo as it impacts Cuba's ability to get medical supplies is a really interesting one. Some of you might have seen coverage of the fact that there was an effort to send masks and some other medical equipment to Cuba by a Chinese businessman that was effectively thwarted by the US government. And this is where these debates about what scarcity means and how it works really come into play, because they prevail even at the level of what the embargo actually does and what it means at the level of medications. And that uncertainty is one that I confronted in my own research looking at the 1960s moment, because on one hand, the US government is insisting that they're not blocking medications from getting to the island. But on the other hand, the US government is clearly blocking medications from getting to the island. So it's a both and situation. On one hand, yes, theoretically, legally, one can still get medical supplies to Cuba, except when you can't. And I think that kind of legal gray area or uncertainty is one that makes this a particularly fraught and politicized question, and also a really important question, because it means that at the level of the most basic material realities, we sometimes are scratching our heads, what exactly is even going on? What is available? And how do we know?
No, that's great. So we have a question from Professor Lillian Guerra from the University of Florida. So, and this is sort of an archive question. She says she's shocked that Antonio Maceo Jr. was a CIA agent. Can you speak more about this archive and more about Antonio Maceo Jr.?
Yeah, so I am fascinated by him as a figure, very important leader, as I said, in the exile community. A very visible leader in many ways because of the strong racial bias of that exile leadership. And CIA agent may be a little strong when it comes to the radio programming, although we could talk about other aspects of his political work and perhaps raise questions there. But what I think is so interesting about the role he occupied, particularly in this radio show, is that there's this constant tension in the archive where he's being told his job is to provide non-politicized medical advice. The viability of the enterprise depends on him not making it too political. Otherwise, it's not credible. And yet he himself, and you see this even in some of the notes, the editorial notes that appear on the transcripts, is constantly fighting against those kinds of limitations that are being put on him. And of course, defying them openly in many other cases, because it's very clear to him, as it is to everybody else, that medical access is a political issue. And he very much makes that part of the framing of the show, in many cases in the form of direct address to his listeners. So this lineage is a really interesting one. And I actually as a result of working on this article, I ended up writing another article about all of these phantom sons and other relatives of the first Antonio Maceo that are floating around following the independence wars in the Americas. And I am waiting and hoping for the definitive biography of all of the Maceo descendants. There's been some exceptional work by historians in Santiago in Cuba, tracing different descendants as they appear and disappear from the historical record. And this is becoming completely tangential, but I think it's really fascinating that with many of the other celebrated patriots of the independence wars, we have authoritative accounts of their descendants and their lineage, and yet there is so much that remains opaque about Maceo's own descendants. So it turns out the very fact of whether Antonio Maceo the first had more than one son, if he did, how many sons there were, how many of them were official? Well, in fact, just one. And he, that official son, was the father of Dr. Antonio Maceo, who I'm talking about here, who he, Maceo, the doctor's father, had left the island, gone to Cornell to get his university education, ends up marrying a white woman in New York, and confronting a lot of issues both here and when he goes back to Cuba as a result of that. So they're a really fascinating family. I tried to probe a little bit Dr. Antonio Maceo's personal biography and didn't get very far in working on this article. So I'm hoping somebody else will pick that up and run with it. The transcripts and the letters attached to this show are all available at the amazing and fabulous Cuban Heritage Collection in Coral Gables, Florida. So a shout out to all of our friends at the CHC.
That's a great shout out if you all are looking for archives, and a lot of their stuff is digital. So especially now, if there's students who, or anyone who's looking for access to archives about Cuba and Cuban Americans, like you should definitely check out the Cuban Heritage Collection at the University of Miami. So we have another question that's coming in from Richard Alt. It says the COVID-19 case numbers for Cuba appear to be less than 10% of the world average, given 10 million or 11 million population. Are the Cuban stats considered reliable? Are any stats considered?
Yeah, I mean, this is like the most basic question, and it comes back to some of the issues that I've been alluding to. You know, how do we have these conversations when we're not even sure we can agree on the most basic terms with which we're going to transact the conversations? I think it is safe to say, and I feel comfortable saying, that Cuba's numbers are low considering what they could have been. In other words, considering the number of foreigners who were in Cuba, because of the tourist economy, the proximity between Cuba and the United States in the form of travel across the Florida Straits, that the very far-reaching and strict public health measures that the Cuban government has taken to arrest the spread of COVID-19, we could say have had some success in keeping the numbers lower than we would have expected them to be. Are the numbers that the Cuban government is offering accurate? I'm not sure there's any obvious way to answer the question at this time. But as Devin is suggesting, I think there may be a lot of questions about other numbers too, perhaps not to the same degree. But I'm even thinking here on my very local level, there was some back and forth in the Rhode Island press as a result of the fact that the discharge numbers that were being offered by the government here in Rhode Island, that is a number of people discharged from the hospital after battling COVID-19, were a little higher than they should have been because deaths were being counted as discharges. So there were some 90 extra people being included in that count who in fact died in the hospital as a result of this illness. And that's just an example of probably a completely innocent kind of slippage in the statistics, as it were, not even engaging the question of whether there might be more sinister efforts to hide numbers at play, which is a very different question that we may or may not be able to answer either for Cuba or the United States. But I think it is fair to say, as I'm suggesting, that the numbers are lower than we might have expected, given the relationship between the Cuban economy and the US economy. And part of that has depended on the Cuban government's ability to really mount very, very strict measures that, as we've seen in our own context, would be almost impossible here.
No, I think that's a great point. And it just sort of takes us back to even how you began all of this, thinking about health and public health as being weaponized and politicized, is that even when we talk about numbers, we're sort of having that conversation, right?
Absolutely.
Whose numbers do we trust versus whose numbers don't we trust? It feels like all of this is caught up very much in sort of politics.
Mhm.
We have a question from Aaron Goodman that says there seems to be more policing related to the relatively new Decree 370 on sharing internet content. Do you think this is related to increased scarcity?
I'm not sure I understand the question exactly, if it's about pharmaceutical scarcity or not, or just whether there is a kind of broad-based repressive effort that's being mounted. I think that's sort of the spirit of the question. And that, I think, is a super fascinating issue. In other words, here we're seeing the ACLU battling left and right against the extension of government power into individual rights in different ways. And of course, that kind of response isn't necessarily possible in the Cuban context, except where it kind of leaks out in the internet world, as it were. So this issue of whether honest reporting is possible, whether the Cuban government is really seeing it as necessary to police the kind of reporting that will be possible about both COVID-19, but also Cuban politics in general, restrictions on internet access. At the same time, of course, that internet access has been slowly expanding. So I think there's maybe no obvious way to answer that question, given that the Cuban government here is going to be in sort of a bind moving forward, and that in some ways that expanding internet access has become a part of the non-state economy that's almost inescapable at this point, and even, as I'm suggesting, a part of the state economy in some ways. Yet there are going to be efforts moving forward, certainly to control the kind of information that is being circulated about those shortages, about scarcity as it emerges. Even as at the same time, as I pointed out, there's been more recognition even in the state media of contributions, say, from the non-state sector. So I think those contradictory things are happening side by side. I hope that answers the question as I understood it.
So we have another question from Cameron Anderson. Can we associate the willingness to accept such, which I think you might have called draconian responses, established by Cuba and other democratic islands in the region, to the status of development rather than the type of governments?
Maybe. I think the most obvious comparison here would be with China. And so the similarities between perhaps the Chinese government's response and the Cuban government's response, in terms of the ease with which the government is able to implement such a full-throated response, but also the kind of lack of ability to formally resist that kind of getting into very intimate territory that, as I said, would be almost impossible in the United States and has been strongly resisted in the United States. So I think I would be probably more inclined to consider it an element of the type of government as opposed to an issue of development. Although certainly I think regionally there might be interesting fodder for comparison here. So Cuba versus, say, other Latin American countries versus China or versus the United States. But it's not a mistake, of course, that Cuba is being compared to the United States. That has long been the frame of reference when we talk about these issues, or to China, I would say, in the present day moment. And we might also think about scale here. So there's type of government, let's say economy, development, but also Cuba is a small island. That is to say, it's surrounded by water on all sides. So when you decide you're going to close the island, that's relatively easy for the Cuban government to do. And it's certainly something that has proven surprisingly challenging, not necessarily on the international front in the United States, but particularly in the domestic front, to what degree domestic travel can be closed down. We've seen this has become a really politicized issue, right? Can you actually prevent travel from one state to the other? In Cuba, yes, you can make it very hard for people to travel from one province to the other, or at least require them to register themselves or to go into quarantine after they do so, and for the government to have very close tabs on everyone. And I'm saying draconian actually without a value judgment, although there might be an implicit one attached to that term. I think people within the island and outside of the island might have actually conflicting feelings about these measures in a way that they might not when it comes to other aspects of Cuban governance. In other words, are such measures justified in the face of a public health crisis when they might not be otherwise? Maybe a really relevant question not just for Cubans, but also for us to confront here in the United States. How much intrusion into our private embodied lives is justified ethically, morally, politically in the face of the threat that we're facing now.
No, that's a really good point. I think that's definitely something that lots of people, leaders, but also just everyday regular people are grappling with, how much intrusion is warranted in this situation. So we have a question from Jesse Holst. Do you think Cuba's response to COVID-19 has strengthened or weakened people's faith in the government? Are there winners and losers in the various government agencies?
I think the question probably is targeted to people on the island. So I'll take the question kind of on those grounds, but I can also talk a little bit about internationally if that's an element of the question as well. So I think I've seen, and this is now informal and anecdotal, a fairly high degree of acceptance of many of these measures, which is to say that Cubans deeply understand the threat that COVID-19 presents, not only in a kind of absolute sense, but in a very specific sense, given the very vulnerable nature of the Cuban economy, the Cuban medical system in many ways, the vulnerability for all the reasons that we've talked about. I think most Cubans understand that Cuba cannot afford to see the kinds of morbidity and mortality that the United States is experiencing right now. The US cannot afford to experience that morbidity and mortality. And Cuba has been able, and Cubans have been able to watch that very closely, both because the revolutionary government affords quite a lot of coverage to the morbidity and mortality that's happening in the United States for political reasons, but also because that is the reality. At a certain point, we have to say, there is good reason for them to look to us as a negative case, as what should not happen in Cuba, which I think may provide for some degree of acceptance of these measures where it might not otherwise exist. So that is to say, where people might otherwise blanch at these kinds of intrusions or draconian measures taken, perhaps understanding that these circumstances are different, which is not to say that that sentiment is universal. And I've certainly seen evidence of people giving negative coverage to, for example, prison sentences for violating government orders, not to leave a hospital or to move around, things like that. Are there winners and losers? I think that's going to be more of a long-term question. In other words, does MINSAP, the Ministry of Public Health, come out of this fortified or debilitated? Maybe too early to tell. Certainly kind of on the international front, I think this is an opportunity for MINSAP, for the revolutionary public health infrastructure in general, to burnish its credentials, as it were, at an otherwise quite challenging time for the revolutionary government, of course, no longer having a Castro in charge, the difficult economic circumstances that Cuba was already confronting as a result of the rollback of normalization efforts. So this context all informs what's happening economically and politically in Cuba now. So will this be an opportunity for Cuba to really renew a certain prestige attached to at least its public health apparatus on the world stage? Perhaps. There's certainly been a lot of visibility both to what Cuba is doing, say, in Italy, but also regionally, that Cuba has been the leader of efforts to address the spread of COVID-19 in the Caribbean, say, and many Caribbean governments have turned to Cuba in the absence of help coming, say, from the United States, when the US is actively thwarting, in some cases, shipments of masks or other PPE to the Caribbean as a self-protective measure, right? So when the US closes in on itself because of the crisis of its own public health infrastructure, does that give the Cuban government the opportunity to really become, once again, a leader, particularly in the area of public health? The answer might be yes. I don't know if the question also is targeted to, for example, the expansion of the state security apparatus. That might be another kind of more long-term question, right? Are we seeing new kinds of paths through which Cuban citizens can be tracked by their government? Perhaps we're going to see the same thing here as well, inevitably, right? And here too, we're going to have to confront this issue, as Devin is suggesting, as to what degree of intrusion interference we're prepared to accept. Are we all going to be willing to fill out the information on our phone as to our symptoms? Do we have a fever today? I think many of us might say yes in a way that would surprise ourselves, right? That a month ago we would have said no, and maybe now the answer has changed. And maybe that's something that historians in 50 years will look back on and say, this was the defining moment when we all decided to fill in the blank.
Well, you actually just answered a question. I'm still going to say the question. So we want to recognize that Lily Hartman asked us, how do you think methods of policing being used in Cuba and the US are now around the virus have impacted and might reach beyond COVID-19 in social spaces and individuals, and how individuals are monitored and surveilled in the future? And you sort of answered that some now. I don't know if you want to say more, because I think what you're saying is like really interesting, right? That like we might agree to more surveillance, but they're already putting things in place and that will have a lasting legacy.
Yeah, absolutely. And I think there will be questions that we will want to have closely in our mind about the disproportionate impact of some of that surveillance and policing on some communities versus other communities, right? Related, particularly in the United States, to disproportionate morbidity and mortality. So here in the United States, I think we see there's a huge gap between the extension of policing and surveillance into marginalized communities, Black and Brown communities, alongside the complete absence of state infrastructure when it comes to healthcare. It's this kind of very contradictory thing, right? The state is hyper visible when it comes to policing and completely invisible when it comes to public health. That gap is perhaps not as acute or not as overtly racialized in Cuba, although we might raise questions about implicit racialization and the degree to which such marginalized communities also exist in Cuba in a way that's relatively invisible to us. But I suspect that that kind of problematic will certainly be part of the future of policing, but also kind of healthcare, public healthcare work moving forward in both places. Historians of medicine have long wrestled with this issue of, in a context of crisis, whose rights are restricted? Is it all of our rights, or do those kinds of restrictions fall disproportionately on some rather than others? And I think that's something that, again, we as historians are particularly poised to help keep an eye on, right? Are we making that same kind of mistake or slippage in the present?
So I think I have about two more questions. This one also comes from Lillian Guerra. She says the European Union negotiated for the release of Cuba's top political prisoner, Ferrer, for months and got him out in April under the negotiated cover of Cuba's sort of splashy mission. Do you have any comments about that?
I don't know that I do, but it's certainly very interesting. I mean, there's this question of political capital that's accruing to Cuba as a result of this work, right? And I think that's a really interesting example of different kinds of political relationships that are going to be forged out of this crisis that may not depend as intensely as they once did on the United States to be effectively transacting them. I think that's sort of the spirit of the question, what kinds of international frameworks will emerge for Cuba's engagement coming out of this. I don't know that economically the world is prepared to fill the place that the US has long held, but maybe there's something interesting to track there.
And that may be some of the reasons to sort of send out so many medical missions, to sort of start using that as a sort of first foot in diplomacy that might happen in other ways in other places.
Absolutely.
And then from Matthew Hill, could you talk about the role of rumor in the Cuban and US context in light of the coronavirus? Rumor is often an important trope given differential access to information. What role is it playing now?
Yeah, I mean, fascinating question, and certainly a very relevant one for Cubanists. Cubans and Cubanists know that Radio Bemba, unofficial word of mouth, is often the way that information gets to Cubans. With the expansion of internet access in the last couple of years, Cubans have been able to add other kind of touchstones to, or media touchstones to their information getting practices, so they don't rely as intensely, I think, on rumor as once might have been the case, at least for international news. I guess the question would be, going back to this issue of even statistics, what kinds of stories are being told at the popular level about what's going on in Cuba? What I hear actually is really interesting, that Cubans are intensely aware of how many cases there are in their towns, in the neighboring towns. It's something that's being shared not only within Cuba, but also in the transnational networks that bind Cubans in the United States to the island. So any kind of WhatsApp conversation these days inevitably comes to the question of how many cases are here and how many cases are there, and what happened to this person who did this and that person who did that. And this is a very important vehicle of information sharing alongside, of course, the kind of information that the government itself is providing. and I think has largely tended to reinforce as opposed to undermine government efforts on this front. Usually these two kind of information circuits exist at cross purposes. In other words, you supplement what you're getting from the government by turning to rumor, which would give you different information. But here I've been fascinated to see how actually they're kind of working in tandem to reinforce the idea that it's very important to prevent the spread of COVID-19. In the United States, of course, we're seeing the circulation of all kinds of, we could call them conspiracy theories. Other people would be less inclined to use that term to refer to them, not only about the genesis of the virus, where it came from, but even about the very nature of the virus itself. This debate is not surprising given where we were before all of this started, our national conversation about fake news, media crossfire, the partisan nature of media coverage. And I've even been surprised to watch how my own kind of media engagement has evolved as a result of this. I think everybody has gone through phases of hypersaturation, followed by needing to check out. And I found myself more and more attuned to local news in a way that I wasn't before, which in a way reminds me of how I would say media practices have evolved in Cuba as well, given the really intensely personal and local nature of the spread of this disease. It's a respiratory illness. It's perhaps not surprising that we become increasingly concerned with having information about what's happening right around us, not just at the national level or the international level, but literally next door. And so I even think on my own block, looking out the window and seeing whose car hasn't left the house for weeks, are they in quarantine, these kinds of things. The role that rumor is playing and how we organize our daily lives here in the United States as well, in the face of sometimes just general uncertainty, not just because the government is trying to hide things, because there's so much we don't know about this disease. And it's perhaps only natural that different kinds of information comes to fill those gaps.
Mhm. I mean, and that makes a lot of sense. It actually connects to something you said before about thinking about Cubans being so medically literate, right? And so sort of scientifically literate, that there makes a lot of sense why on one hand, they might be more trusting or open to that type of medical and scientific knowledge than versus here in the United States in a way, just because there's always been this very comfortable space of talking about pharmaceuticals and generic drugs and what are you taking and how do we do this? So yeah,
You would be hard pressed to find Cubans as skeptical of the seriousness of COVID-19 and the importance of taking steps to address it, as is like highly visible here in the United States. It just would be almost impossible for all the reasons that you're pointing out.
right. Well, thank you so much. This has been really fascinating, like just sort of thinking about the ways that public health is weaponized, the way medical workers might be weaponized, the way conversations about scarcity have been in the past and will therefore continue to be a part of politics going forward. Do you have any final thoughts that you'd like to share with viewers, or just something that maybe we didn't get a chance to talk about?
Well, I just want to thank everybody again for tuning in and say that I hope that as we think about the kind of place of historical work, that we can have these conversations about the ways in which medicals, pharmaceutical conditions impact social relations and also subjectivities. I think everybody is increasingly attuned to the fact that we are not going to be the same. We individually, collectively, as a result of however long this self-isolation lasts. And what that means in a place where you can barricade yourself in your house and watch Netflix nonstop versus in a place where in order to access goods, you must leave the house, I think is going to be, even at the most basic level, a really important difference to keep an eye on.
No, thank you so much, Jenny. This has been fabulous. I'm so glad you were able to join us. Everyone at Davidson, but also just in sort of the global community that participated in tonight. Thanks you. I want to invite everyone back next Wednesday at 7 p.m. Eastern Time when my colleague, Dr. Dasa Mordetson, will welcome Dr. Wayne Soon, Assistant Professor of History at Vassar College, and he will be discussing the 2003 SARS pandemic in East Asia. So please tune in for the last talk in the series. This has been really exciting and so much fun. Everyone have a great night and take care. Thank you.